Hi, this video is the art of hair transplant restoration surgery result with 1 year post-op week before another photo by Dr. Diep. This client had an FUE done by me a year and 1 month ago, which is in June 2016. And the result looks fantastic. It's very natural and very dense. And we did 3,262 hair graft, and the hair graft was done by the FUE method, and I was the surgeon who personally pulling the hair graft one at a time and extract it manually. Only the FUE specialist can harvest the hair graft one at a time by him or herself manually. The surgeon or the doctor are not specialized in FUE, so they buy a robot machine or neograft, and the result, of course, is different. Actually, this client had a friend who had an FUE done in India, and it's around 3,600 something graft, but the result is not even close in terms of comparison to what his result is, which is done by me. His friend had it done in India, has poor density, and of course it's not as natural. And so I'm going to show you what he looked like before, and that's where he was, total front half right there. And then we lower the hairline, brighten the temple. You see how nice and natural. And on the right hand side, we brighten the temple, lower the hairline. You see how natural, nice zigzag, and it has good volume as well. Left hand side, we'll lower the hairline, brighten the temple as well. And we did give a medium tight hairline zigzag, and top view, and we filled the whole frontal area. And that's where it was a year later. Before, 1 year later. But hair transplant, again, more than just the surgical skill. The surgical skill gives you the density, but the artistic and aesthetic detail is the one that will give you how natural the hairline is. And for this client, we actually gave him a 7.5 centimeter. But you see how natural, nice, and zigzag, and it's soft, and it's natural. And even when you cut, no one can tell you have had any surgery done. When you have a haircut and all stuff, because he had an FUE, so the scar is not really visible at all. You can turn face straight toward me. There we go. Again, we can comb through so the audience can see this is his real hair, and excellent density. Not just excellent density. We comb through to the right, we comb to the left. And I comb through all this stuff, and I comb through all this. Because one audience request that I comb through, not just straight down, comb from the left to the right, and from the right to the left. But just to show that it is his real hair, and it's natural, and it's dense. We can turn this left hand side right here. And then comb down. And you see how nice zigzag down. And this client, he actually read quite a bit and did quite a bit of research before he come to my clinic. But the most important thing he understand what I'm talking about is the artistry of the hairline and the zigzag and the type of. And the zigzag is really important to my hairline because it can give you a very natural look without. Because no hairline is straight, so the more zigzag it is, the more the more natural it look. And again, the type of zigzag depend on the personality. If you look all the way down for me, perfect. Okay, look a little bit more down. More, perfect. That's his hair. You see? That's now, and this is before. Again, hair transplants is very dependent on the clinic and the surgical skill of the surgeon. Yes, some clinic can charge really cheap, but then in the end, if it doesn't really grow, then it end up going to cost you more because you're gonna have to do another surgery. So when you do surgery, and it is going to be for the rest of your life, and it's your face. You want to have the most natural hairline, you want the most density, and you want to reduce the chance of having come back to repeat. To do another surgery, and if you want the FUE, you gotta ask the surgeon if he or she the surgeon who personally pulling the hair graft one at a time, because if the surgeon does that manually, they are the FUE specialist, and that tend to give you the most density. If the client, if the surgeon cannot do FUE manually by himself, then by relying on robot, a neograft machine, and a neograft is technician operating, so it's no comparison. And again, the result vary from one individual to another. It normally take 1 year for it to fully grow, but for this client, he had his result 7 months, and then I'm extremely happy because he had the result in time for his wedding, and that's completely changed him. He looks fantastic for the wedding, and his photo, he mentioned to me, extremely natural and a full set of hair. And of course, medicine will not give you his hair, because most clients will use medicine before, of course, Propecia Rogaine, and you had to use medicine for the rest of your life, or you can have the surgery. And again, that's part of the perk of being a hair surgeon. Financially, we do well, but one of the most happiest moment for me, and I take a lot of gratification, is to be able to make a difference in a person's life and to change their look and their life for the better, and not only give their handsome face back, but give them their self-esteem, and that's one of the great gratification in terms of hair transplant. Again, when it comes to hair transplant with the FUE, you have to make sure there's a FUE specialist. You have to make sure that it's very natural, and there's a whole artistry of creating hairline as well. And this is the 3262 graft. Thank you.